Good morning, everybody. First of all, I'd like to thank CannMed for giving me this opportunity to share with you my talk on cannabis product recalls. So first of all, I'd like to share with you the learning objectives. You will learn that product recall information, availability and quality is varied. Reasons for product recalls have been numerous, and many specific contaminants have caused product recalls. I believe that everyone knows a lot of this information, but I wanted to go over it. And this is the cannabis testing regulations by state. So first, the states that are orange, they have testing rules for both medical and adult use. And there's one error there for Alaska, that should be orange. Then you have the green states, that's testing rules for medical use only. Then there's the green state that has diagonal stripes, that's Kentucky, and it's not because they don't want to test for medical cannabis, it's because they just passed legislation and they haven't adopted their first set of rules. Then we have the light gray states. They have the legal cannabinoid programs in two remaining states, Idaho and Nebraska, whereby cannabis as adult use, medical use, and cannabinoid programs are illegal. Next, I wanted to give you an idea. We know that 38 states have legalized programs. So with that in mind, what we did is that we went into the cannabis regulatory sites. Well, first of all, I'd like to acknowledge that the original source of the recall data set in its version 0.1 was provided by Jamie Toth, who is presently the director of the Institute of Cannabis Science, and she gave this to me to expand. And so the states depicted in black in the regulatory agency website, we found some recalls in the website, one or more. Then the states that are blue with the gray diagonal lines, they didn't have any recalls, but we identified investigative news reports that depicted recalls. So you can see examples of New Mexico, Missouri, Illinois, New York, and Maine. And I believe there was a total of 9 recalls from news articles. Then we have the light blue is no recalls. And I'm not going to make any conclusions in the sense there's 2 possibilities. One, that the cultivators, processors, product manufacturers have such good practices that they never fail a test. Or there are recalls, but it's not in the regulatory website. And of course, all the states depicted in white, there's no legalized cannabis programs. Oh, by the way, I forgot to mention that 20 states out of the legal states had recalls in their websites. So I wanted to just take a step back and talk about the FDA product recalls that we're all familiar with. What is the purpose of FDA recalls in the pharmaceutical and food industries? And that's safeguard public health, ensure consumer safety by swiftly addressing contamination or product mislabeling to ensure consumer safety and drug efficacy. So here are some examples of 3 food and pharmaceutical recalls. So all 3 of them come from this year. And so we have the top row, it's a food recall, and it's some cashews. and that it is microbial contamination. Then in row 2 and 3 are pharmaceutical products, where the first one was a potential lack of sterility assurance in an eye ointment, and the other one is a oral suspension that's a medication for, it's pneumocystis carinii, which is a causative agent for lung infection. For individuals that are immunocompromised, such as HIV and AIDS, or they take massive amounts of steroids, which lower the immune system. And the contamination was a bacterium, Bacillus cereus. Now, the methods that we did is that we had the source documents of all of the recalls, which encountered at up to 262 recalls. We reviewed each document, we extracted and inputted the additional information. The 3 examples would be the product type, the reason for the recall, and specific contaminants or other issues. So then we performed comparative analysis and created visualization of the results, which now I will show you. So we have 262 recalls in the 20 states up to March 2024, and there's been a lot of recalls since then in the range of around 25 additional recalls, but are not included in this analysis. So in this pie chart, the top 5 states, and with their percentages depicted in this pie chart, is Colorado, Washington, Michigan, and Oregon. And I must say, there's been a lot of recalls coming out of the DCC in California since our study. And then we have the remaining states as shown in the pie chart. So then we did an analysis from 2016 to 2023, and you can see that in 21 and 22, it's about the same number of recalls, and all of a sudden in 23, it more than doubled. So I wanted to take a look at what states stepped up. So we have the 5 states, Arizona, Colorado, Michigan, Oregon, and Washington stepped up, which accounted for greater than 90% of the doubling in the recalls in 24. So recall quality as compared to, let's say, FDA recalls. And so here are the examples, like in the movie, The Good, Bad, and Ugly. We have the good, that's the state of Colorado, has very detailed recall documents where the sample types are always identified. In almost all cases, the specific contaminants or other issues are identified, and also all the different products from all the different dispensaries are identified in a massive list. So we have examples of a pesticide, flour, trim, concentrate, and infused products. So the pesticide contamination, actually, this microbutanil was the pesticide that was most identified, and I looked at in terms of possible human repercussions. It's a steroid demethylation inhibitor, and I understand that after ignition, cyanide is produced. Then we have the flour, shake, and trim, and another recall, and then we have microbial contamination. And one of the Aspergillus human pathogens in that state, I believe, speciation is not required. So it could have been Aspergillus flavus, Aspergillus fumigatus, Niger, or Terrius. And there are over 20 clinical case studies identifying cases of individuals with cannabis use and getting aspergillosis or other respiratory ailments. So again, as a third example, flour, shake, and trim, we have metal contamination, mercury, which is the symptoms are central nervous system. The bad and ugly. So what we have is, in many cases, specific contaminant name was not provided. So in the state of Washington, many of the recall notices in which a pesticide exceeded the action limits, the specific pesticide was not named. And in Michigan, whatever contaminants exceeded the action level, they also were not identified. So the nomenclature for recalls in the 20 different states, of course, is different accordingly to regulatory agency, and we did our best, the team, to see the commonalities, and we whittled it down to 17 reasons for product recalls. And in the y-axis, in the red, I just wanted to, differentiate between recalls due to contamination versus other issues. But the top two, which accounted for greater than 65% of the recalls, was for pesticide contamination and microbial contamination. Pesticide contamination, almost 40%, and microbial contamination, almost 30%. Some of the recalls had multiple microbials, multiple pesticides, or a mixture of pesticides and microbials, and so forth and so on. Oh, and let's see, going back. And keep your eye on the bottom, and that's always not provided. So you can see the reasons for product recalls, almost all the time they gave a reason. So then you have the recall by product type, and so the top two, you can see that plant material, over 40% of the recalls, multiple products, which included plant material, was getting into the range of 25%. And almost 10% of the time, the sample type was not provided. So here comes the pesticides. There are 23 pesticides that were specifically identified in our recall. And I sincerely hope that the regulators for each jurisdiction examines this list and review their own lists as a possible indication that if it's not included in their list, they might want to include it. And so the top one is the myclobutanil, which accounted for over 20%, and then you see the others as they decrease. And I put in red the 1, 2, 3, 4 azole compounds. And these, the medications, the primary medications for aspergillosis are azole compounds. And as a microbiologist, there is a possibility that we're introducing pesticides into the soil or the solid matrix in cannabis production that may be causing the increase in azole-resistant Aspergillus strains in the environment. And then in pesticides, there were a lot of recalls, over 30%, in which this pesticide was not named. So for microbial contamination, the two winners, over 40%, is total yeast and mold and the 4 Aspergillus pathogens, with a couple in Salmonella species. And I just want to make the statement, as a microbiologist, in a vast majority of the states, I believe over 60% of the jurisdictions require total yeast and mold from action levels that range from 10 to the 3 per gram upwards to 10 to the 6 per gram. In that I know there are differing opinions out there. Does one really get any information as the sample submitter whether the sample has any pathogens? And then there weren't that many recalls in metal contamination. 16 out of the 262, we see the big four, and there are some states that test beyond the big four. And then there was just one recall with ethanol that exceeded the action level, and one with mycotoxins, but it wasn't designated whether it was aflatoxin or ochratoxin. So the future directions is that there are 18 remaining states that there are no recalls, and I'd like to actually look into the possibility of forming a collaboration with the Institute of Cannabis Science to make many, Freedom of Information Act requests to get recall information from the remaining states where there are no recalls in their agency websites, update the data set and repeat the comparative analysis. But ultimately, all this data is to advocate for standard information of all recalls, to have a much higher quality of the recalls, and to have transparency in all the jurisdictions so that we can protect the people and to ensure consumer safety. And just as a quick summary, the contaminants, they may pose a health risk to consumers, and that the pesticide residues on cannabis products have the highest percentage, almost 40% of total recalls, and the microbial test failures is 29% of total recalls. And I'd like to acknowledge the individuals that did all the work, really. But we have 4 tasks. The data set source I already mentioned was from Jamie Toth at ICR. The data set expansion and the analyses and the results visualization. And Summer, she's our all-star. She was involved in everything, and Needy and I help with the data set expansion. And so, anybody have any questions?
Colorado being the good, is that the best model that there is out there? Is it comprehensive? Is that a good model for a state like Texas, for example?
Please welcome Kevin.
Where our state's moving forward with regulation of cannabis slowly but surely. And so we want to institute best practices from other states. Is Colorado the best model for us to look at? Are there improvements Colorado could make that we may want to consider as well?
Well, I can say that definitely Colorado is one of the best. We have a small staff, and it would have been really nice to line up a subset of every state and really dig in. But I can say off the top that Colorado is the best. And Heather Krug, who is from the Colorado Public Health and Environment Department. She's the regulatory branch manager that oversees the cannabis program. But they also combine their efforts with the other regulatory agency, the MED. But it's a great example and to look at, and we can have offline communications to identify additional states. Thank you very much.